Hi everybody, and welcome to our module on fungal pneumonias. Since this is our first module on fungi, let's talk about a few basics of what fungi are. So first of all, you need to know that fungi cells are eukaryotes. This means they have a nucleus, they have intracellular organelles, and they're very different from bacteria. Bacteria are prokaryotes. They're a much more primitive form of life. They lack a nucleus and they lack internal organelles. When fungi are single-celled organisms, we call them a yeast. And some of you may know that baker's yeast is used in bread. It releases carbon dioxide, and this is what makes bread fluffy and light. When fungi form multicellular structures, we call them either filamentous molds, or you may know mushrooms are fungi that grow out of the ground to release spores so that more fungi can grow. And we say that a fungi is dimorphic when it can exist either as a single-celled yeast or as a filamentous mold. Ones that can only exist in one form are called monomorphic. Fungi like to form structures called hyphae. These are long branches, and this is a picture of some of them down here in the bottom left. I think of them like branches of a tree. Sometimes the hyphae are one long cell, but often they're divided into multiple cells by structures called septa. These are called septate hyphae when the hyphae has little lines separating one cell from another. When multiple hyphae are grouped together, we call them a mycelium. And then another important term to understand is that of conidia or spores. These are like seeds that the fungi release to form more fungi. And often the conidia are formed at the ends of hyphae in a structure called a conidiophore. And this is a picture of a conidiophore right here. You can see that it's got lots of little dots on it. Those are little spores that the fungi is ready to release to grow and form more fungi. So to keep the fungal infection straight in your mind, I recommend you group them into three categories. The first category are the fungal pneumonias, which we'll talk about in this module. They only occur in specific geographic areas, and knowing the geography of where the disease occurs is very important for the diagnosis. We'll talk about histoplasmosis and blastomycosis and coccidiomycosis all in this module. There are the skin fungal infections like tinea versicolor and tinea pedis, which is athlete's foot, and also sporothrix, which is an infection that you can get when you're gardening. We'll talk about that in another module. And finally, there are the opportunistic infections. These are like Candida and Aspergillus and Cryptococcus and mucormycosis, also pneumocystis. These only happen to people in certain immunodepressed or vulnerable states. So there are four fungal pneumonias you need to know about. These are histoplasmosis, blastomycosis, coccidiomycosis, and paracoccidiomycosis. And they can all cause pneumonia, but they each have some unique features that you need to know about so you can recognize them in board questions. First, let's talk about some key common features that are shared by all of the fungal pneumonia infections. All of these fungi can cause pneumonia, but they can also disseminate and cause diffuse disease. And usually dissemination of these infections occurs in patients who are immunocompromised, like patients with HIV/AIDS. All of the fungal pneumonias are caused by dimorphic fungi, and usually at cold temperatures, which is outside the body. In nature, they are found as molds. When they get inside the body and they are warm, this is where they form yeast. And because they commonly form yeast inside the body, when you look at these fungi on histopathology, usually they will be small single-cellular structures, and that's because they assume the yeast form in the body. Disease generally comes from inhaling fungus, not from person-to-person spread. And all of the causes of fungal pneumonia can cause granulomatous inflammation in the lungs. And this is the same thing that tuberculosis does in the lungs, and therefore infections with the fungal pneumonias is a potential mimic of tuberculosis. You can think a patient has TB and they actually have one of these fungal infections. And in general, for all the fungal pneumonias, the treatment for mild disease is with the azole drugs like fluconazole or itraconazole, and the treatment for severe disease or systemic disseminated disease is with amphotericin B. And I talk about all these drugs in another video. So let's pause here and review the causes of granulomatous infection. So most people know that tuberculosis and leprosy can cause granulomas because those are mycobacteria. But the tricky ones are the remainder on this list. So the fungal pneumonias, like we'll talk about in this module, can all form granulomas. Bartonella, which causes cat scratch disease, and Brucella, which causes brucellosis. These are both zoonotic infections and they can cause granulomas. Infants who get listeria from their mother can get a condition called granulomatosis infantiseptica, and it's got granuloma in the name, so that can help you remember that the baby will have lots of granulomas. Schistosomiasis, which is a helminth or worm infection, causes granulomas. And finally, in syphilis, the gummas that people get are granulomas. So in terms of USMLE Step 1 questions, all of the fungal pneumonia questions are going to have two distinct clues to diagnosis. The first will be the geography, where they occur, and the second will be the pathology. So we'll talk about both of those features now. So histoplasmosis and blastomycosis basically have the same geography. They both occur in the Ohio and Mississippi River valleys. Blastomycosis can occur a little bit around the Great Lakes, but basically these two are going to have the same geographical location of where they occur. Coccidiomycosis, on the other hand, occurs in the southwestern U.S. It is a disease that's very common in Mexico, so it occurs in the states that are near Mexico. And then paracoccidiomycosis is easy to remember because that doesn't occur in the United States. It occurs in South and Central America. So if you're not good at geography, you may need a reminder of where the Mississippi and Ohio river valleys are. So let's review that now. This is a map of the United States. So the Mississippi River starts up in Minnesota and it runs right down the middle of the United States all the way down to the Gulf of Mexico. The Ohio River starts in western Pennsylvania and then runs down below Ohio and intersects with the Mississippi River. So people who are at risk for histoplasmosis and blastomycosis are going to be in this area of the United States. Usually they will use the term Ohio or Mississippi River Valley, but sometimes they won't, and they will describe the Midwest, or you may hear the word Ohio or Mississippi in the question stem. Coccidiomycosis is a disease from Mexico, so if you can just remember that, it's easy to know the states where you're going to find it in the U.S. It's going to be in California and Arizona and New Mexico and all the states that are down here close to Mexico. So in question stems for histoplasmosis or blastomycosis, you'll often see the words Ohio River Valley, Mississippi River or River Valley, the Midwest, or sometimes the Great Lakes, especially for blastomycosis. For coccidiomycosis, they're usually going to name one of these three states, Arizona, New Mexico, or California. And then, as I said before, paracoccidiomycosis doesn't occur in the U.S. It occurs in South and Central America. So now let's talk about each of the fungal pneumonias individually. So the first one is histoplasmosis, which is caused by the fungi Histoplasmosis capsulatum. And in nature, this fungi is found in soil contaminated with bird or bat droppings. So a key site for infection is caves. And if you ever see a question stem that says a patient was spelunking in caves, this is one of the first things you should think about because they're often exposed to bat droppings when they do that. Humans inhale spores and then it becomes a yeast at body temperature, and once it gets inside the body it's ingested by macrophages. And you can remember that tuberculosis is also ingested by macrophages. So histoplasmosis is similar size, it's taken up by the same cells, and so it makes sense that it also causes granulomatous inflammation just like tuberculosis. Once this fungi gets inside macrophages, it can survive and multiply and then eventually spread to other macrophages in the lungs. The vast majority of people who are exposed to histoplasmosis are asymptomatic, and this is true for all the fungal pneumonias. If they ever ask you the most likely outcome of exposure, it's nothing. Most people don't ever get symptoms. When people do get symptoms from histoplasmosis, it's usually pulmonary, so they get a slow onset pneumonia over a few weeks. It's usually a mild pneumonia. They may have hilar lymphadenopathy on their chest x-ray, and again, just remember that this is a tuberculosis mimic, and you know that tuberculosis causes hilar lymphadenopathy, so it makes sense that this does as well. You can diagnose histoplasmosis by blood tests for antigens and antibodies, but you can also do it by a biopsy. And on your USMLE Step 1 exam, they'll often show you a biopsy slide because it has some characteristic findings, which we'll see in a minute. And as I said before, this is treated the way all the fungal pneumonias are treated: fluconazole and itraconazole for mild disease, and severe or systemic disease treated with amphotericin B. And here are two pictures of macrophages filled with the yeast cells of histoplasmosis. And remember, this is a very small fungi, so many of them can fit inside one white blood cell like you see here. The cell-mediated immune system is very important for clearing this fungal infection, and that's another analogy to tuberculosis. The cell-mediated immune system is important in tuberculosis as well. This fungi can disseminate, but that's very rare unless people are immunocompromised. So people with HIV/AIDS or people who are on TNF-alpha inhibitor drugs, these are the type of people who rarely can get disseminated histoplasmosis. There are lots of symptoms of dissemination that you can read about. It can involve almost any symptom, including the GI tract, the central nervous system, the bone marrow, and the lymph nodes. Some key features that I think are worth knowing about so you can recognize this in question stems: the liver and the spleen will often be enlarged. Patients may have abnormal LFTs. Ulcers are a very unusual and easy to recognize symptom of disseminated histoplasmosis. These can occur in the tongue or in the mouth. And then you know that this fungi likes to infect macrophages, so it makes sense that it can infect other cells and therefore involve the bone marrow and cause pancytopenia. And the treatment for systemic disease is amphotericin B. The next fungal pneumonia is caused by Blastomyces dermatitidis. That's the causative agent of blastomycoses. So it shares many similarities with histoplasmosis. Just like with histo, you inhale the spores or conidia, and then they become a yeast inside the body. It's a dimorphic fungus. Just like with histo, most patients are asymptomatic, but when symptoms do develop, a slow onset pneumonia is the most common presentation. So there are many similarities between histoplasmosis and blastomycoses. They both have a similar geographic distribution, and they both cause a slow onset pneumonia. But one thing that's different about blastomycosis is that extrapulmonary disease is very common. About 20% of patients will have this. The skin is the most common site, so patients with blastomycosis can get these wart-type lesions with irregular borders on their skin. Then the second most common site is to have bone involvement and osteomyelitis from this infection. So the classic case of blastomycosis will be somebody with a Mississippi River exposure and slow onset pneumonia, and this can look a lot like histoplasmosis, but the unique features will be the presence of skin lesions and possibly bone pain. And then one other thing to remember is that histoplasmosis is associated with cave and bat exposure, and that's not the case for blastomycosis. So blastomycosis forms granulomas, just like all these fungal pneumonias can, and the classic pathology finding is a broad-based budding yeast, and this is a picture of one down here. Most yeast cells, when they divide, will form a little stalk and then they will bud off a second yeast cell. This is called narrow-based budding, and this is very common. What blastomyces does that's unusual is that the second yeast cell that buds off will have a broad connection to the first one, so there's much more of the two cells touching each other. That's called a broad-based budding, and that's what's unique to blastomyces. And you can see that these cells are budding off with a broad connection to one another, and that's what's unique about blastomyces. And the diagnosis is usually by visualizing the yeast, either in sputum or in tissue, and it's treated like all the fungal pneumonias with fluconazole and itraconazole for mild disease and amphotericin B for severe or systemic disease. Next, let's talk about coccidiomycosis. So remember, it's common in Mexico. So you're going to find it in all the states that are near Mexico, like Arizona, New Mexico, Texas, and California. It grows as a mold beneath the desert surface, and in dry conditions, the mold fractures into spores. And you get sick from inhaling the spores, just like you get sick in all the fungal pneumonias from inhaling spores. What's unique about coccidiomycosis is that it's not dimorphic. In the lungs, the spore does not become a yeast. Instead, it enlarges to a structure called a spherule. This is not a yeast, so it's not dimorphic. The enlarging spherules produce endospores, and then the mature spherules rupture, and they release all their endospores. And each endospore can produce another spherule. So this is how it multiplies inside the body. So the classic pathology finding here is a spherule filled with endospores, and this is a picture of one. You can find lots of other ones online, but it's a structure that contains lots of smaller circular structures, and those are the endospores. Just like with all the fungal pneumonias, most infections are asymptomatic, but people who get sick get a condition called valley fever. So they have fever, malaise, and cough. They also get joint pains, and then they get a skin finding called erythema nodosum. Erythema nodosum is inflammation of the fat tissue under the shins. This is a picture of it over here. You can get this in a number of conditions. It's not specific for coccidiomycosis, but it does occur as part of valley fever. You can make the diagnosis by sputum culture. It very rarely disseminates, but when it does disseminate, the feared result is meningitis. There are reports of coccidiomeningitis, and people can get very sick. And the treatment is the same as for all the fungal pneumonias, fluconazole and itraconazole for mild disease, and amphotericin B for severe disease. And the last of these fungal pneumonias is paracoccidiomycosis. So this doesn't happen often in the United States. It occurs in Central and South America. This means for a board question, they may very well describe to you someone who's recently traveled to one of these two places. Patients get pulmonary symptoms like a cough, and what's unique about this fungal infection that you need to know is that it has a classic pathfinding called the pilot's wheel or the Mickey Mouse head. So let's look down here on the right. What's happening down here is that you have a mother cell in the middle budding off multiple small cells on the side, and that's why it forms this structure that looks like a pilot's wheel. Sometimes it's described as a Mickey Mouse head. So if you look at this picture on the left, if you look up here, you've got a mother cell budding off two little daughter yeasts, and they almost look like Mickey Mouse ears. So if you hear a description of the pilot's wheel or the Mickey Mouse head, what they're describing is paracoccidiomycosis, and the reason is because the mother yeast cells bud off lots of little daughters all at the same time. Let me finish this module by mentioning Aspergillus. So I talk about Aspergillus in detail in the module on opportunistic fungal infections, but I mention it here because it can also cause pneumonia, but you should never ever confuse it with any of the fungal pneumonias mentioned in this module. So Aspergillus pneumonia only happens to people who are immunocompromised. So it's going to happen to people who have HIV or who are on chemotherapy. It has no specific geographic area. It can happen anywhere. Aspergillus is monomorphic. It does not form a yeast cell, so it's going to have hyphae, and you should never confuse it with any of the small yeast cells that we talked about in this module. And furthermore, patients who get Aspergillus pneumonia get very, very sick. So they have fever, they get hemoptysis, pleuritic chest pain. It's going to look very different from the patients with mild pneumonia symptoms that we described in this module here. And that concludes our module on fungal pneumonias.